Thank you very much. Thank you and Delta Dental for this great conversation about access to healthcare. Our next guest joined the Marines in 2001, just before 9/11. He led an infantry platoon, was among the first Americans to reach Baghdad in 2003. He's a disruptor. He was the only Democrat to unseat an incumbent in a primary in 2004. Democrat of Massachusetts. It's our honor to welcome to the Axios stage, Congressman Moulton. Congressman, thank you very much.
Thanks.
So congratulations. As of Halloween time, you are a new dad.
Yes, October 10th.
So tell us about Emmy.
Emmy's amazing. I mean, she's incredibly well behaved. Occasionally acts like a baby, but generally pretty amazing. And people told me different things to expect. They said, well, when the baby's new, she just gets really attached to the mother, and sometimes dads don't have much to do. But I'm totally attached to Emmy. I mean, I can't believe how much I miss her. I mean, we've barely met, right? We've only known each other for a few weeks, and I can't stand being away from her. So it's been an interesting experience being a first-time dad.
Okay, this is gonna be a sharp turn. Backstage, you said something to me very sobering. I said, just making conversation while we're waiting for Jason to come out. I said, what are the chances of a shutdown? And you said, high.
That's what I'm hearing. The chances are high. The two sides are pretty far apart. People don't want to compromise. This could change any minute, as we know with our erratic commander-in-chief. But we don't know at this point. And right now it seems like the two sides are pretty far apart. So my intention is to spend Christmas in Massachusetts, not here in Washington, D.C.
So you still get your health care from the Veterans Administration. How does that affect your view of it? And this is an area you've been very active on.
When I was elected, I made a commitment to continue getting my health care from the VA. I said, until we can fix this, I want to experience what everybody else is experiencing. And I had gotten my health care from the VA before running. And I'll tell you, it's a mixed experience, as I think people well know.
By the way, have a water. We have quite an arsenal of waters here. So, yeah.
Oh, my gosh. They're labeled.
They're all untouched, so help yourself.
Moulton's water.
Special.
It's great. Thank you. It's excellent water. Definitely better than Kane's water, I'm sure. Senator Kane is a great friend. So my experience at the VA has been, I would say, generally positive. For example, I have a great primary care physician. I've had several great primary care physicians. And, statistically, across the board, VA healthcare is pretty good. But we've all heard the horror stories. We all know that there are some hospitals that are great and some hospitals where people are dying on waiting lists. What we've tried to do in my office in Congress is work very diligently on improving the VA. So we passed a bill in my first term to make it easier for veterans to simply get access to VA healthcare. Veterans are going to be able to get appointments right on their iPhone. There's an opening on Thursday, someone just canceled, I can select that. That's not possible right now for the VA. We've also been working more recently on some bills to make it easier and safer for veterans to talk about using cannabis. Because there's a recent survey that said that about 1 out of every 4 veterans is using cannabis right now, but they don't feel safe even talking about it at the VA with their provider. So we have a package of 3 bills, bipartisan bills. One will make it clear that if you're using cannabis, you can talk about it with your doctor. And they're not going to be facing any repercussions no matter what state you're in or whatever else. 2, we have a bill to just study this more, to understand how veterans are using cannabis, whether it's working or whether it's not. And the 3rd is to actually educate VA healthcare professionals on cannabis. I think it's clear that this is where things are going. I was supportive of the legalization initiative in Massachusetts. I think that we need to realize people are going to use marijuana whether we like it or not. So let's make it legal and let's regulate it to make it safe.
In the last campaign, in the midterm campaigns, you found yourself in Ohio faced with a huge health crisis.
Yeah, so I worked really hard to help win back the House, and I supported a next generation slate of candidates across this country, especially veterans. And I spent some time with Ken Harbaugh running in Ohio. And we went out with a sheriff's deputy at night, and then we went out with the fire department in the morning and really saw the effects of the opioid crisis firsthand. It was
so take us on that midnight run.
It's amazing how many calls they get. And we didn't have to wait long at all for us to get called out. We went to one call with the fire department where, there's a guy who had OD'd. He was very clearly close to death, lying in this pickup truck. And I watched as these local heroes, these first responders, saved his life with Narcan. And they did it very professionally, and it was clear that they had a lot of experience with this. And we talked to them. They said, we do this multiple times a day. It's just old hat for them. We went to, with the sheriff's deputy, several domestic violence cases where you can see the effects of drug use, not just on an individual, but on an entire family and a community. So this is a real plague. Frankly, one of the reasons why I support using marijuana or cannabis for vets is that that's an option that a lot of vets see as opposed to getting stuck with opioids. A lot of vets are using cannabis because they don't want to get addicted the way so many people are, especially in tough places like the heartland of our country where they're really struggling.
And what's it like to talk to these first responders? Are they businesslike? Are they sad? Like, what's it like when they're out with their Narcan?
I mean, they're totally professional. They're businesslike in that sense. But it just feels like we're not making any progress on this crisis, right? It's not. I mean, they're out there responding to a problem, but not doing anything to really stem the flow. We're not addressing the root causes here, and so that's all they're doing. Is there's person after person, life after life, they're out there trying to save, but it feels like an endless cycle. And it's one of the reasons why we've got to actually have healthcare in this country that really stops these issues before they start. There's no question that the pharmaceutical industry is largely responsible here. Let's stop having the pharmaceutical industry dictate our healthcare policy.
You've made yourself a student of the automation economy. How do you see the automation economy playing out in red and blue America?
Well, I took some colleagues up to MIT, just south of my district, where they've done some amazing studies on the future of work and how automation is changing jobs and how many jobs are getting lost, not to immigrants like the president says, but to just robots. I mean, that's how the workforce is changing. And when you map this out, when you map out the communities that are more susceptible to automation versus the communities that are less susceptible. So like the bio industry in Massachusetts, not terribly susceptible to automation. The academics, institutions, not terribly susceptible to automation. Machine plants, auto plants, really susceptible to automation. When you map this out, it's pretty amazing because it was a Syrian immigrant, actually, a Syrian refugee who did this mapping at the MIT Media Lab. And I don't think he knows much about American politics, but he chose blue for communities that were safe from automation and red for communities that were in danger of automation, and it looked like the congressional map of the United States of America. It was amazing. And that tells me two things. One, Trump and the Republicans have actually been pretty effective at tapping into this feeling of being left behind, that a lot of Americans are left behind by this economy. They're hurting, they're struggling, they can't get ahead. They used to make a decent wage, their wages haven't gone up, or maybe they used to have a job as a machinist and now they're working at McDonald's. But at the same time, the blue parts of the country, the Silicon Valley, the Cambridge, Massachusetts, that are represented by Democrats, they're already doing okay with automation. This means that if Democrats can figure out how to solve this problem for the red parts, we have a lot of districts that we can win back.
And what would be on the short list of how you would tackle that?
Education. We reformed our education system because of the industrial age. We said people are coming off the farms. We've got to have everybody go to high school. This is a new world, and we've got to make sure we have an education system to max. We have not made those reforms to our education system now. Half the jobs that will exist in 2040 don't exist today. Half the jobs in just 20 years. So that means that even if our education system were perfect right now, which God knows it's not, we still have to re-educate half the workforce. So we've got to have an education system that isn't just about going to high school and college once in your life, but is more focused on skills training, on technical training that you can get throughout your career. So that's probably the number one. There are a lot of other things we can do too, but I think that's number one on my list.
You've talked a lot about a new generation of leadership for Washington. You turned 4-0 in October.
Jesus,
You
need to have some more water here.
you were among the Democrats who challenged the automatic ascension of Speaker Pelosi, the automatic return of Speaker Pelosi. Now that that race is clearly shaken out, what do you think the dynamics are going to be for House Democrats come January?
Well, we didn't just challenge Speaker Pelosi, we challenged the top three. Because the top three in our party, haven't changed in 16 years, and I don't think that reflects the generational change that this election was all about. And we just said, look, let's have a democratic conversation about this. Let's not just get them reappointed. Let's actually have a conversation about that, and that's where this has gone. Now, at the end of the day, we tried to create the space for other people to run, and nobody else has run. So I think that what you'll see happening over the next maybe even few hours, but few days, is coming to a deal that will make some long-term changes to how the party operates, that will enable young people to actually have more of a voice in our politics and rise up into these positions, while also coming together as a party so that we can be unified in opposing this administration.
How are your relations with Speaker-designate Pelosi these days?
Well, they've been better than the last few weeks, but this is part of democracy. It's about having a debate, and sometimes when you're having a debate and you're on different sides of an issue, you have a vigorous debate. But I think what Democrats as a party are good enough to do and strong enough to do is have that democratic debate, just like we have a real democratic debate about health care, right? Republicans in the last Congress were just trying to take health care away from people. What Democrats want to do is actually have a debate about how we can lower costs for healthcare and expand access. And if we do that, it'll be a contentious debate. And there will be some Democrats who really disagree with other Democrats. But at the end of the day, that's democracy, and that's healthy, and that's what we should do.
One thing you pushed her on was a plan for transitioning out of leadership. I maybe missed that story, but I don't feel like she's put forth a very specific plan to transition out.
Well, we're hoping to get something along those lines.
Yesterday, she seemed to be just getting warmed up.
She did great yesterday. But we want to make sure that all the young people... I mean, look, we have a Congress that doesn't even understand Facebook, right? I mean, we saw that, right? We have a lot of challenges that we need to address that are next generation challenges, and we just want to make sure our generation has a voice in that debate.
There's a lot of conversation about you and 2020. You're not running, I get that. But you have talked about there's a cry for leadership. How do you decide how you answer that cry for leadership over the next couple of years?
Look, I didn't expect to be in politics. This is not what I planned to do. I got out of the Marines, and like every aspiring Massachusetts politician, the first job I took was in Dallas, Texas. Okay, so this was not on my radar screen. I'm here really because of, in large part, because of an amazing woman named Emily Cherniak, who started this group called New Politics, trying to get service veterans, and not just military veterans, Peace Corps, Teach for America, City Year veterans, to run for office on the theory that we understand a little bit about what it means to serve the country. And so that's why I ran in the first place. And I'm going to continue doing whatever I can to serve this country in the best way possible. That's what guides me. And that's what guided me in this leadership fight. I think it's the best thing for the party and for the country. It's what guides me in my healthcare work, my work with the VA, and it will guide me in whatever I decide to do next.
There's something like 30 Democrats who are running or thinking of running in 2020.
That seems low, isn't it more than that?
How do you think that's going to work out for the party?
I think it'll be great because we'll actually have the kind of debate that we deserve to have. I think a lot of people in 2016 felt like, with all due respect to Secretary Clinton, she shouldn't have just been sort of coronated. And the fact that Bernie got up and introduced things like college loans into the debate that weren't really part of the party's discussion until he showed up on the debate stage was a very healthy thing for our party and for our country. And I think we'll see that like times 10 in this election, and it'll be a great thing for our democracy.
And as we say goodbye, what's it like to go on Seth Meyers?
It's nerve-wracking at first. I actually had to follow a comedian, right? So it's like you're supposed to be funny on this show, and I was going on right after a comedian, but it was really fun. He's a good guy.
What's it like behind the scenes?
Behind the scenes,
yeah.
They have a lot of food. Yeah, they have a lot of food, I guess, to maybe.
I bet they didn't have the superfood toast that we have here. We have the fanciest toast you'll ever see.
They have food and they have drinks.
That we can't top at this moment, but We'd like to thank Delta Dental for making this conversation about access to healthcare possible. The Axios events team for their miracles overnight. The Axios healthcare team for their expert coverage that we appreciate so much. I'd like to thank all of you for coming. And Congressman Moulton, thanks for a great conversation.
Thank you.